Hi, Namaskar, and hope you're doing well. I am RJ Adaa, and we're here for a very, very special and important cause and reason today. 29th October is celebrated worldwide as World Stroke Day, and its purpose is to spread awareness about the seriousness of stroke and the rising number of patients that suffer from it so that people have the opportunity to understand and find ways to avoid it. Honestly speaking, I am not qualified to speak about this, and that is why we have the experts to tell us about the causes and effects and to help us figure a way out in a proper way. And that's why today I have with me Dr. Nitin Dange, जो कि एक consultant interventional neurosurgeon here at Global Hospital and Leelavati Hospital, Mumbai. Doctor, I know you're a doctor, but we have to ask you, how are you?
I'm good. Thank you. And I hope you are also good.
Yes, absolutely. Grateful. And fortunately, I'm good. You look pretty lively today. It's great to see that. Uh,
Very well.
Thank you for joining us. So, Doctor, the first question, and I believe that this is something that we know is a concern, but we tend to take a lot of things lightly, and that is why we are here. The first question is, what is brain stroke and how severe is this disease?
So just I will talk in the layman's language so everybody is able to understand what's the major, and I will use my medical terms and
Yes.
go to basically a very simple language.
Okay.
That's what it's not
Yeah,
so easy
that
to
would be
explain
yes.
at the level. So brain strokes, as you know, brain is the controlling center of the body, human
Right,
body.
right,
So it's the supreme part of the human body,
right,
and it requires nutrients as well as constant oxygen supply.
right.
Now, this oxygen supply and nutrients is supplied through the blood, and these are the blood circulates and supplies constantly throughout life.
Okay.
What happens is suddenly there is stoppage or blockage of the blood circulation to a part of brain, and what happens is the important vital neurons of the brain are deprived of circulation. They do not receive oxygen as well as nutrients, and they start dying. And this blockage or reduction in the circulation leads to death of the cells, which is called as a stroke.
Okay.
So there is another part where there can be a sudden bursting of the blood vessel, and also it can cause pressure on the nerves or neurons, and it can lead to death of the cells, leading to a hemorrhagic stroke. So basically, there are two types of strokes. What we talk of, one is a blockage stroke in simple language, and one is a bursting or a blood vessel burst and cause a brain hemorrhage. These two types of strokes are very common, and out of that 85% of the stroke are blockage or ischemic strokes, while the rest 15% is usually hemorrhagic stroke, what we call as a brain hemorrhage. Or they say there is some bursting of the blood vessel leading to brain hemorrhage. So this is what happens in a stroke. Now, stroke is a very important part of our day-to-day life. It is the incidence is increasing. 1 in 4 people suffer from stroke in the lifetime. However, very few people reach to the hospital, and today's WHO, World Stroke Organization says that you need to don't stay at home. You need to be reaching the hospital as soon as possible.
Ah, interesting. Okay, so of course you told us what that is, but what's also important is to realize that it's happening. So, what are the symptoms of stroke, and how do we recognize if someone has a stroke, especially in today's day and age where we're all hustling and we don't tend to
So,
identify.
so there is a simple mnemonic which is very easy to remember. Be fast. Now, be fast is a mnemonic. What I will just explain. Be fast. B means one can lose balance. E means
Okay.
eye signs. That is, you can have double vision. And fast. This is also a very important mnemonic which can be remembered. F means the face becomes drooping or one side, or it becomes crooked. Then A means arm. That is, arm becomes weak. One side arm becomes weak, or the leg becomes weak. And speech. S means speech. Speech suddenly becomes altered. The patient is unable to speak or express. Now, if you have this FAS, that is, face becomes crooked, arm becomes weak, or speech is altered, or there is expression difficulty. T is for time. You have to rush, or time is very important, and starting of the treatment as soon as possible if one develops these symptoms. So this is very, very crucial that identification of the symptoms is the most important key factor and then referring or rushing to this patient who is suffering from stroke or these symptoms is the key for having good outcomes. Now, I'll tell you the most important thing: the person who may suffer from stroke may not understand what's happening to him or her. Now, this is the most important thing that society needs to be aware. If anybody around you or the relative or near or kin suffers from a stroke, these may be the symptoms. Once you get such symptoms in a patient or whoever is nearby you have to immediately rush this patient to the nearby stroke ready center or a comprehensive stroke center. It's not right to refer this patient to any center. It's very important, a stroke center, which has a basic facilities like doing a CT scan or a MRI, and neurologist, neurosurgeon, interventional neurologist, and interventional neurosurgeon or a neurologist, and a person who and a team who is dedicated, who can attend such patient, such center, these patients should be referred.
All right. It's of course vital to get it, sort of attended to as soon as it happens. But it's also vital to try and prevent all of this. So,
Absolutely.
how can a stroke be prevented?
Yeah. So the basic thing is 80% of the strokes can be prevented, which is a very, very important message, which I can share with you. The most important thing is you need to have a healthy and balanced diet. Okay? Controlling of the blood pressure, diabetes, cholesterol, alcohol intake, and stopping of smoking. These are the major risk factors which can cause stroke, and these are modifiable risk factors. Means you can control your blood pressure, you can check your sugars regularly, you can reduce your cholesterol, you should stop excessive alcohol intake, and smoking is very, very important. You have to stop smoking. And the most important message I would like to give here is you have to have a physically activity. You should be physically active, burning your calories and remain fit.
Right. And these are all the most difficult things in life to do.
It's very easy to do, but this is the most important factor. One can prevent stroke, and
Yeah.
believe me, 80% of the strokes can be
Yeah.
prevented if you can follow just these simple things. I
That
know
is
it's
true.
not simple to it's simple to say,
Yeah.
but
Yeah.
difficult to follow. But that's
I mean, like, what is simple anyway in life? I mean, you'd rather take it this a healthy way. I mean, आधे लोगों को तो stroke type की feeling आ जाएगी अगर उनको बोलो कि ये सब नहीं करना है. So, all right. What are the treatment options for stroke, doctor?
so there are two ways of treating a stroke. The most important factor in the stroke treatment is today is time. So we call a golden window period. Why time is important? Every second a neuron keeps on dying. And once the death of a neuron, the brain doesn't have the capacity to regenerate. Now, having said so, you have to start or open up the vessel or start treatment or begin the circulation as soon as possible so that you prevent the death of the cell and permanent disability or death. So what we do in this is the first 4.5 hours from the onset of symptoms. This is very important. The
Okay.
message is very clear. There are people who come to us saying that within 24 hours any patient can be treated. It's not that. So within 24 hours means from the onset of symptoms. The
Correct.
first symptom, whatever it might be, whether there is drooping of the face or arm weakness is there or one-sided weakness, that is the first second we count as the onset of symptoms. Within the first 4.5 hours, we give an injection for a ischemic blockage stroke through the IV, that is called as a thrombolysis. What it does, it bursts the clots and open up the vessel. If there is a blockage which has a harboring a clot or what we call a thrombus, it lies or it dissolves the thrombus. This is called as a thrombolysis. But it can be given in only one first 4.5 hours. This is the golden window period. Now the second treatment, what I do and we all do is we do a mechanical thrombectomy. Mechanical thrombectomy is nothing but we take this patient into a cath lab or an angiography suite, and through the groin, through the thigh, we enter the patient's vessels and reach the brain. And we identify where is the blockage. We put a small stent on the blockage area at the site of blockage. We open up the stent and we retrieve the stent along with the clot. This is called as a stent retriever thrombectomy. And today, the world has been preached and advised that we can go up to 24 hours of onset of stroke. This can be done for major stroke. So imagine we have a treatment option up to 24 hours. In the first 24 hours of onset of stroke, we can go in, we can remove a major blockages and cure the patients. There can be reduction in the disability, there can be reduction in the mortality, and patient can be normal. The earlier you start the treatment, earlier you give treatment or do this thrombectomy, the patients can be without any deficit. The most important devastating complication of any major stroke is usually a disability. Paralysis is what we call. And imagine today we have options of curing a paralysis. The initial earlier days, once a patient has a stroke, we had a myth that this patient is finished or the person is finished. No, today we have treatment options. We need to be aware that first 24 hours is the golden window period from the onset of stroke, and we have to rush this patient to the nearby center where this facility is available and do the stent thrombectomy or open up the vessels and restart the circulation.
All
So world
right.
is advanced very technologically today. The guidelines are saying that we can do these procedures. I know it's a little difficult to understand in layman, but I made it very simple. A blockage can be opened up by removing the thrombus by using stent. We don't keep the stent there. It is just used to retrieve the thrombus and open up the vessel. This is can be possible in major strokes in 85% of the strokes. This is a very good option we have, and fortunately and unfortunately the problem is stroke does not have pain. The patient suffers. It's not like heart attack that one rushes to the hospital. The patient who is suffering feels that something is going wrong. Here the patient is not understanding what's happening with them. So the nearby kin and all, our society should be made aware that treatment options are available. You need to take the right patient to the right hospital, to the right team who can deliver these good results.
All right. That's wonderfully put, Doctor. You spoke about golden hour, you speaking about in the right time. So, why is there so much discussion about time when we talk about stroke? I mean, it's quite apparent, but we'd like to hear.
So just to elaborate more in details, time is the key factor. Why we say that time is brain, because the most important thing, as just mentioned in the initial thing,
Yes.
the brain is the vital organ. It controls whole of the body, and every neuron has some function. Now, if these neurons or nerve cells in the brain get deprived of oxygen or nutrients, and every second there is some cell death or the function is lost. Now, if you don't address these issues in time, definitely there will be a permanent disability, loss of function. And that's why time is very, very crucial. 8 out of 10 people are disabled at 3 months. This is the even today's statistics. You can imagine there is death of 90 lakh brain cells every minute. 19 lakh brain cells die every minute. So the functionally important. It is the function. Now we are talking, you are understanding, we are completely normal. These are the functions. Every second counts. If there is a stroke, somebody is suffering, the neurons keep on dying and they undergo death, which can be avoided, prevented, and they can be kept normal if you start treatment within the golden window period or as soon as possible.
This is sounding borderline scary now. Okay, so doctor, the theme for World Stroke Day this year, 2020, is "Don't Be the One." So, इसे explain कीजिए.
Yes, so this is the thing what we are talking of. As we have said that the incidence has increased. The 90%, I would say 90% of the stroke today can be having this modifiable risk factors. Now, I'll just elaborate the simple things which I already done in the previous uh, answers. That you have to have a very simple, very careful lifestyle. You have to give time to yourself. If you have to remain healthy and fit. So these are the following risk factors which can be controlled, and you can prevent a stroke. And we don't want to be the one who is going to suffer from it. So how do we do this? This is the theme which is we are talking of. That is, you have to control the high blood pressure. Exercise at least 4 to 5 times a week. I won't say every day, but at least 4 to 5 times a week. Eat healthy and balanced diet. Reduce your cholesterol. Maintain a healthy weight. So both things are related. A healthy and balanced diet, which will obviously control your weight. Don't have hypercholesterolemia or reduce your cholesterol. Stop smoking. Smoking is the very major risk factor which we see in today's world. Young patients are coming with stroke 20, 25, and they are having major blockages with heavy smoking. So smoking can be avoided or reduced, and reduce alcohol intake. So these are the major things which can be addressed. Plus, most important is one of the other risk factor. Now we say that 1 in 4 suffers from a diabetes. So these are the also we have to, whoever is suffering from diabetes, they have to control their sugar levels very well, take treatment, and introduce healthy diet as well as exercise and manage stress. This is the 10th and important factor. It's though I know today's life is so fast under stressful conditions, but we have to have time for ourselves, manage the stress with various behavioral therapies like introduction of yoga, meditation, and various ways each individual can decide for themselves to manage stress. So I've just elaborated the modifiable risk factor. Why I am saying modifiable? If you just understand the seriousness of the stroke, it's not at all difficult. And I trust me, it's not at all difficult because I myself follow it as a healthy lifestyle. You have to keep fit, maintain yourself, weight is under control. You should not have blood pressure, diabetes, all these things. If you are regularly following these simple things and give time to yourself, I know in the fast lifestyle, you are not having time to think for yourself. But it's very, very crucial that you give some time. 45 minutes per day is very, very important that you can exercise and control all these modified risk factors.
Super. Thank you, doctor, for all of that information. And before I end this, I want to ask, like, there are so many tips that you have given. And being a doctor, how difficult or easy is it for you to get time out for your exercise or for health regime? What do you do to keep healthy and कैसे करते हो with all
So
that?
basically, it's very important that I'm very, very regular in my exercises. I work out every day for 45 minutes, may it whatever it may be. Usually, the morning hours are very, very important for me because relatively there are less emergencies in the morning hours. So it's very crucial for me. My uh, diet is very, very particular, specific. I am very, very careful about my diet. I'm very, very health conscious. And most important thing, what I feel is you may eat something which is having high calories or something. But the message what I always convey is you burn those calories. Exercise regularly and you'll definitely have less stress. The exercise gives you mental stability. You can overcome the stress as well as you can be out of diabetes, hypertension, high cholesterol. Everything will be sorted out. And this is the message which I want to give as a doctor and a neurosurgeon.
Thank you so much. And here's hoping we burn the calories also at this Diwali, not just not
Yeah.
crackers. Thank you so much. Of course, doctor has told us so much about taking care of stroke. What happens when you face it or see someone facing it. So definitely, अगर ऐसा कुछ हो, please ensure that they reach a good doctor or a medical center at the earliest and look after the patients. And the most important thing is, and I'm sure Dr. Nitin will agree, that you have to stay aware of whatever is happening around you. So thank you so much. That was Dr. Nitin Dange. He's a consultant interventional neurosurgeon, Global Hospital and Lilavati Hospital. Thank you so much, and you take care, doctor.